Depression is a mental health disorder characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities. It can also cause a variety of physical and emotional symptoms, such as fatigue, difficulty in concentrating, changes in appetite and sleep patterns, and thoughts of self-harm or suicide. Depression is a common condition that affects people of all ages, and it can have a significant impact on a person's ability to function in daily life. It can be treated with a combination of therapy, medication, and lifestyle changes. The development of depression in an individual can be influenced by a combination of genetic, environmental, and psychological factors. Studies have shown that people with a family history of depression are more likely to develop the condition. Researchers believe that certain genes may make an individual more susceptible to the condition, but that other factors are also involved. Environmental factors, life events or ongoing stressors such as loss of loved one, financial troubles, a traumatic event, or chronic stress can increase the risk of depression. People who are low self-esteem and who are pessimistic, or who tend to ruminate or dwell on negative thoughts, may be more at risk of developing depression. In addition, negative cognitive patterns such as rumination and maladaptive coping strategies can make an individual more vulnerable to depression. It's also worth mentioning here that depression can also be caused by some medical conditions, medications, or substance abuse and can develop differently in each individual, and the cause of it can be complex and multifactorial. An accurate diagnosis and treatment are best done under the guidance of a mental health professional. Kinds of depression. There are several different types of depression, each with its own set of symptoms and causes. Some of the most common types include major depressive disorder, MDD. This is the most common type of depression and is characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities. People with MDD may also experience physical symptoms such as fatigue, changes in appetite and sleep patterns, and difficulty concentrating. Persistent depressive disorder, PDD. It is also known as dysthymia, and this type of depression is characterized by a low-grade depression that lasts for at least 2 years. People with PDD may experience symptoms similar to those of MDD, but they may be less severe and longer-lasting. Bipolar disorder. This type of depression is characterized by swings between episodes of mania or hypomania and depression. People with bipolar disorder may experience extreme highs, mania, and lows, depression, that can last for days, weeks, or months. Seasonal affective disorder. This type of depression is characterized by a recurring pattern of depression that begins in the fall or winter and ends in the spring or summer. SAD is thought to be caused by the decreased amount of sunlight during the fall and winter months. Postpartum depression. This type of depression occurs in women after giving birth. It is characterized by feelings of sadness, hopelessness, and difficulty bonding with the baby. Psychotic depression. This type of depression is characterized by symptoms of both depression and psychosis, such as hallucinations or delusions. It's important to note that depression can be highly individual and it can take different forms. Depression is a treatable condition and there are several different treatment options available. The most common treatments for depression include therapy. This can include cognitive behavioral therapy, CBT, which helps individuals identify and change negative thought patterns, or talk therapy, which can help individuals understand and work through their feelings and emotions. Medication. Antidepressant medication can be effective in reducing symptoms of depression. Selective serotonin reuptake inhibitors, SSRIs, are the most commonly prescribed antidepressants, and they work by increasing the levels of serotonin, a chemical in the brain that regulates mood. Electroconvulsive therapy, ECT, is a treatment option for severe depression that has not responded to other treatments. It involves passing a small electric current through the brain to trigger a seizure. Light therapy. In the case of seasonal affective disorder, SAD, light therapy can be used to mimic the effects of natural sunlight on the body and brain, helping to regulate mood. Transcranial magnetic stimulation, TMS. This is a non-invasive procedure where magnetic fields are used to stimulate nerve cells in the brain. It is used to help alleviate symptoms of depression for those who have not responded to other treatment options. Lifestyle changes, regular exercise, healthy diet, adequate sleep, and stress management techniques can help to alleviate symptoms of depression. A combination of therapy, medication, and lifestyle changes can be effective in treating depression. It's also important to continue treatment even after symptoms improve to prevent relapses. It's important to note that early intervention and treatment can help to mitigate the negative effects of depression on human development.